Hi, my name is Elizabeth Castellon. I'm a senior social worker here at the Menninger Clinic, and I'm also the director for the Pathfinder Community Integration Program. Patient-centered care means that whenever a person comes into the room to meet with me and other team members, we're really curious about who they are, what their views are on the world, what their views are on relationships, how we can get to know who they are and what they're bringing to the table in terms of their treatment. It means that we're going to share our minds with them, that we're going to tell them why we're making decisions, why we think something is, why we're recommending something, rather than simply making decisions in silos without them. It doesn't mean that we do everything the patient wants us to do, because sometimes people may choose something that is not helpful to them. But it does mean that we take into account what their overall goals are, and that we always share our minds and we're transparent about what we're doing. I think that patient-centered care is very important at Menninger, and we combine that with a really strong team-based approach. It means that multiple disciplines are working with a person to try to understand them. We really believe that no one discipline is like the holder of all truths, right? Or that has the best recommendations. We think that having multiple minds, multiple approaches is going to be the best way to get to know a person and get to know the different aspects of their lives that they're trying to make changes in. As a director, my role is to coach teams. And so I can think of a specific client, person that we're working with that my team is, trying to help. And there was a big, conflict between the family and the team, because the family wanted us to do something, and the patient, based on whether they were sitting with their family or whether they were sitting with a team, would answer what she thought people wanted to hear. And so, patient-centered care meant really getting together with the family and this patient and understanding this dynamic was happening, and then helping that young person feel empowered to make their own choice. And really also holding them accountable to, hey, you're presenting so differently to everybody. It's really hard to know how to help you. What feels so scary about telling us what you really are feeling and thinking? Can you really help us understand what you think your needs are and how we communicate this to everybody? And it was a really good conversation with her, and she was able to open up about things that she had a lot of shame about, that she didn't feel comfortable telling people. She was able also to reflect on this pattern of having her parents come in and rescue her and overfunction for her. And ultimately, she made a hard decision. She opted to do the thing that she thought was hardest, but everybody could get behind that and support her and really cheer her on for doing the hard work. Yeah, so young adults are bringing a lot of their own specific challenges to this journey. And so I think here at Menninger, we really understand that we have to get to know that specific person and what their challenges are. You can have a 20-year-old that we can label the challenge as like failure to launch or difficulty with, kind of creating structure and support in their lives, but ultimately that can look really different based on their own strengths. And so we understand that there might be challenges related to navigating relationships, navigating stressors related to work and school, now social media. Some people are really struggling with how to regulate their self-esteem in a world that's just really overwhelming. Some young people are also really struggling with a sense of identity. And so really honing in, what is this person's struggle? And how do we help them navigate it based on their unique challenges? Because all of those things are usual challenges for young people, but not everybody's going to struggle with every single one of those challenges exactly the same. So we really need to get to know the person. Young adulthood is a time of major transitions. people are trying to figure out who they want to be in the world and what they want to do with their lives, and they're trying to figure out a meaningful role for their lives. And at the same time, they don't have the resilience that one builds throughout life by experiencing minor challenges and then feeling confident in doing that. And so it's a really unique time. And this is unfortunately also the time that major mental illness first starts to present itself for many people. So it's really a perfect storm, and a time that can, really present a huge challenge for many families. And how you support them can make the difference between a young adult really becoming independent, feeling confident in themselves, in their decisions, building a life that they really want to live, versus getting stuck and feeling unable to move forward and living a life, that doesn't have that meaning for them. So we know that when we involve young adults in their own treatment, outcomes are better. We know that it strengthens their sense of self. We know that it strengthens their trust in themselves. This really leads to more independence because the person has the self-confidence to move forward and to trust in themselves. So it's a huge factor. For a lot of the clients that we're working with here, they have struggled with, major mental illness, with trauma, with a lot of adverse life events. So building trust can be really, really difficult for many people. And what we try to do with getting to know someone, we're trying to send the message of your mind is important, your thoughts are important, who you are is important. We're going to take the time to get to know you. We're going to take the time to have you trust us and we trust you back, and we're going to learn how to have a trusting relationship together. That's one of the most important things that we do here at Menninger. What I really hope families and young people out there take away from this is that there is hope, that there is help, and that there's a team of people waiting to help out as best as we can, get to know them as people, and help them move forward.